Wollaston.
Thank you, Mr Deputy Speaker. It's a pleasure to follow the member for Redcar. Could I start by just thanking and paying tribute to all the frontline care staff around the country, and also to all the family carers, informal carers, and those who are working extremely hard in voluntary services around all our constituencies. In mine, I'd like to pay tribute to Dartmouth Caring, to Totnes Caring, Brixham Does Care, South Brent and District Caring, and also Kingsbridge and Saltstone Caring. And I know that across this House there are similar voluntary services working in tandem with the NHS, providing excellent care to our constituents. But they are under pressure as never before. And I'd also like to just touch on the people who are affected by all this, those who are in need of care services and who aren't getting those services at the moment, not only working age adults but older adults, and the impact that has on them, the devastating impact both on them and their families, but the impact it has as well on the NHS. Because if people can't access those services, it's not just about the impact it has on their dignity, their mobility, their well-being, but also the fact that they're much more likely to end up in hospital services and NHS services, a place they don't want to be, sometimes with serious illnesses or injuries that could have been avoided by having better prevention and early intervention, in places they don't want to be at much higher cost. And we need to deal with this, and we need in this House to appreciate the scale of the challenge. And if we look at the demographics, we know from the ONS data that last year 18% of our population nationally was over 65, but in 14 years' time we'll be looking at 23% of our population nationally being over 65. And of course that's a good thing that people are living longer, but people are living longer with multiple disabilities. And we need to be prepared for that. And we not only need to be prepared for the scale of the shortfall that we face right now, but what is coming in the future. And if we're talking about funding of social care, we need to not only acknowledge the shortfall that we have here and now and the impact and how we're going to deal with that, but seriously planning for what is coming down the track. In my constituency, we're already there. We have a much older population here than in my constituency than many parts of the country. And what's happening there is that even where people can afford to pay for care, they can't find the workforce to care for them. There is a real crisis in our social care workforce, and that needs investment in that workforce. And that needs us to value that workforce and nurture them. And we know what works, but we also know that that is going to require some serious investment. And I'm afraid that one of the features of debates like this is we see the sort of bouncing backwards and forwards of blame, when in fact what's really needed here is cross-party working and consensus building, because the funding choices that we face are difficult choices. I agree with the member from Redcar who highlights absolutely why this can't all just be funded at a local level. It just widens inequality because the areas that are least able to pay have the greatest need. So we widen inequalities. It's unrealistic for this to all come locally. So we need to be working towards having a national solution to this problem. And both the Health and Social Care Committee that I chair, and I know that we work together with the Housing, Communities and Local Government Committee, and I'd like to pay tribute to the member for Sheffield South East who's also spoken about this, that we know what works. And this is the tragedy here, that we could do this. We could deal with this, and our joint committees worked and achieved a cross-party consensus, but we also worked alongside a citizens' assembly, because we feel it's really important that we build consensus outside this House as well, looking at those options. And there are some principles here that we should be following. And I really would urge the Minister in her response to tell us when the social care Green Paper is going to be published, and to commit to making sure that that social care Green Paper looks at the work of our joint select committees and the Citizens' Assembly, because I think that we can move forward. But if we've learnt anything from the Brexit process, surely it has to be to acknowledge that you can't build consensus at the end of a process. You have to build it in right from the start. So that I hope that the Green Paper will be looking to do that, to build that consensus and to set out that principle of fairness about how we fund this. Because I think one of the statistics that we should all be aware of here is that in that next 14 years, as our demographic increases to having 23% of our population over 65, that reflects the fact that in that time, we'll have 4.4 million more citizens who are over 65, but only 1.5 million extra citizens who are under 65. And it simply isn't sustainable to allow all of this extra cost to fall on working age employed adults. We need to actually look at how we're going to spread this fairly across the generations and between the employed and the self-employed. And I agree with other speakers this afternoon who've talked about reimagining national insurance as national health and care insurance. Because if we're truly going to move towards a system where we can look at not only eligibility criteria, but actually expand that, expand quality as well as eligibility, we do need to be bringing more funding into the total system and not having it just coming from local sources. So actually, could I urge the Minister in her response to set out the what she feels about the kinds of measures that were highlighted in the Joint Select Committee report, and whether the government is going to commit to actually coming up with a solution that can deliver real change for the future, rather than one that kicks this down the line. Because I think that the wrong lesson to learn from the last general election campaign would be, don't ever set out who has to pay more. We need to be doing that across this House now, in between the election period, and being realistic with all our constituents that essentially everybody needs to pay more, and that does include setting out and building trust with them that they know that that's going to be delivered in a fair way. Because the consequences, if we just do nothing, is that more and more of our constituents are going to be left in desperate conditions without the carers to look after them, that more and more of our care providers will go to the wall, that we'll see no increase in the quality of care that is delivered on the ground because there won't be the funding there to support the workforce. So I really think that we have to grasp the nettle with these very difficult choices. And finally, just before I close, I'd just like to say something about Brexit. There is no version of Brexit that's going to deliver anything positive for health and social care. And in particular, if we look at the impact on the workforce, the Minister will know that particularly in parts of the South East and London, the social care workforce is very heavily dependent on access to a workforce from the European Union. It's also the case in my own constituency, but nationally the figure is around 7% of the workforce. And if we actually cut off access to that workforce, not only are we missing out on an incredibly important and valued, skilled workforce, because we're making it more difficult for them to come here, but we're also adding costs. And many of the people who work in social care, in fact, the vast majority, will not meet the current proposed thresholds in terms of earnings to be able to come here easily on Tier 2 visas, for example. So we need to have a way of nurturing our workforce, making it easy for people to come and work here and to feel valued. And I don't want to be meeting any more people in my constituency who work in the NHS and social care who are telling me that after decades of dedicated service to this country, that they no longer feel welcome.